Hi everyone, welcome back to my channel. My name is Barfin. I'm an oncology physical therapist, and in this video I'm going to show you some mobility and stretching exercises you can do within the first 2 weeks after your breast cancer surgery that will help you with your recovery. After any breast cancer surgery, it's very common to experience pain, shoulder weakness, restricted mobility of your shoulder, and also tightness in your chest and underarm region. Because of these symptoms, you might be hesitant to move your arm, which can actually worsen these symptoms and contributing to further complications down the line, such as frozen shoulder or rotator cuff dysfunction. I know when to start therapeutic exercises after your breast cancer surgery can be controversial. However, it's very important for you to start as early as you can in order to not only improve your range of motion and flexibility in the shoulder region, but also to prevent future complications. The exercises we'll go over in this video are generally safe. However, every individual is different, so if you had complications or if you had reconstruction at the time of your surgery, please speak with your doctor to make sure these exercises are appropriate for you. First, we're gonna start with diaphragmatic breathing to help improve lymphatic flow. After any surgery, swelling up to 3 months is very common. However, with breast cancer surgery specifically, it's very common to remove lymph nodes from the armpit. Our lymphatic system is responsible for removing the fluid between the tissues and returning it back to the bloodstream. So removing the lymph nodes can block the drainage from the arms, causing fluid to build up in that area. When we do diaphragmatic breathing, we're actually engaging our diaphragm, and that up and down movement of the diaphragm can stimulate the lymphatic system, will return that blood and fluid back to the heart. So we're going to start with one hand over the chest, the other one over the belly. The most important thing with diaphragmatic breathing is trying to keep our chest as still as we can while breathing only with our belly. We're going to breathe in through our nose for a count of 4, hold it in for 1 to 2 seconds, and breathe out through our nose for a count of 6. Next, we're going to do neck rotation. After breast cancer surgery, neck stiffness is very common. Our neck muscles attach from the neck all the way down to the shoulders. So because of that close proximity, it's very common to experience neck stiffness after this kind of surgery. In order to prevent stiffness and maintain your range of motion, it's important to do mobility exercises. So with this exercise, we're going to stand or sit tall with our shoulders back and down. From here, we're going to go ahead and turn our head slowly to the left. Once you feel a gentle pulling, which is a stretching feeling on this side, we're going to stop and hold for 2 to 3 seconds. And then we're going to come back to our starting position. And we're going to turn our head in the opposite direction. Again, you're going to feel a gentle stretch on this side. As soon as you feel that pull, just stop and count to 2 or 3 and come back to neutral. Next, we're going to do shoulder shrugs to get our shoulders moving. With these, all we're going to do is shrug our shoulders as far as we can go, hold it at the top for 1 to 2 seconds, and relax and let the gravity take over. Again, we're shrugging our shoulders, go as far as you can go, hold 1, 2, and relax. You can do these 10 to 15 times either on day 1 after your surgery or the next day. And within a few days, you can actually progress these to shoulder rolls. With these, we're going to go ahead and bring our shoulders forward, up, back, and down. Bring them forward, up, back, and down. So we're doing a full circle. You might feel some pulling in your chest, especially when you bring your shoulders back. Just make sure you're not feeling anything intense and that you're not feeling pain, especially where your incision is. You can do these 10 to 15 times and repeat 3 to 5 times a day. Next, we're going to do shoulder range of motion exercises to help you reach forward and sideways. We're going to go ahead and place our palm on the affected shoulder, and from here, go ahead and lift your arm up as far as you can go. You can feel some pulling in the chest area, however, make sure it's only a mild pulling, nothing intense, and we definitely don't want you to feel pain, so stop right before you feel any pain. And slowly bring your arm down. Most patients start with 40 degrees, which is right about here. However, in a few days, as your pain levels go down and you're recovering from your surgery, you can actually work your way up, increasing your range of approximately about 5 degrees every day. Keep in mind, if you still have drain in place, you won't be clear to go over 90 degrees, which is when your elbow is at shoulder level, so you won't be able to go past that point. Next, we're going to go sideways. So we're in the same position, but this time we're raising our arm sideways. You might feel a little bit more pulling with this direction, but just make sure it's only a mild pulling and stop before you feel any kind of pain. The same thing with this, you can increase your range in a few days. However, if your drains are still in place, make sure your elbow doesn't go past your shoulder level. And with this exercise as well, we can do 10 to 15 repetitions, and you can perform it 3 to 5 times a day. Next, we're going to do scapular squeezes to waken up all these muscles in the back. After the surgery, you might realize yourself in a forward posture position, which is very common. When we have an injury or surgery, our body goes into a protective posture to protect the area that's healing. So in this case with breast cancer surgery, as our shoulders shift forward, everything in the front becomes tight and our back muscles actually become lengthened and weak. With scapular squeezes, we're going to work on activating those muscles in the back so they're getting stronger again. You can have your arms by your side. I like having them bent at 90 degrees. From here, we're going to go ahead and bring our elbows back. Think about trying to bring them together behind your back, and at the same time we're pinching our shoulder blades together for 2 to 3 seconds and relax. I like thinking about having a pen between my shoulder blades and trying to pinch the pen. The most important thing with this exercise is making sure your shoulders are staying down. So the most common mistake people do is shrugging their shoulders. So keep your shoulders down, pinch that pen between your shoulder blades for 2 to 3 seconds, and relax. With this exercise too, you can start with 10 to 15 repetitions, holding for 2 to 3 seconds. However, as you do more and more, you can actually increase your hold times to 5 seconds and then 10 seconds, and you can repeat it 3 times a day. Next, we're going to do a pec stretch, which is located in front of your chest wall. Lie on your back with your knees bent. With your palms facing up, let your hands lie at your side. You should feel a gentle stretch across your chest without any pain. You can hold this position 10 to 15 seconds and repeat this exercise 2 to 3 times a day. If you're not feeling any stretch in this position, try sliding your arms out to the sides more, almost forming a T position with your arms, but stop when you feel a nice gentle stretch in front of your chest, and make sure you're not feeling any pain with this exercise. As you recover from your surgery and you are able to hold it longer, you can first try holding this position for 20 seconds and then work your way up to 30 seconds. That's it for this video. If you found these exercises helpful, please share it with others and subscribe below. You can also join our private Cancer Fitness Facebook group. And if you want to learn more about lymphedema and cancer rehabilitation, you can find me on Instagram. Both of these links can be found in the description below. Thank you so much for watching.